addressing alcoholism in the community.
Thank you. Am I audible? Uh, I first want to thank the Department of Medicine for the invitation to speak, and I want to thank you all for attending. I know that we are late and you're all waiting for the coffee break. I'll try to do this as fast as possible. So the topic that we are addressing is how do we address the alcohol problem in community? Uh, we would look first at how is alcohol a problem to individuals who consume alcohol. Then we would see how big is the extent alcohol problem in India, and then we will see how we could address it from a clinical perspective. What could be from the perspective of education and policy. Then we'll see a small case study of how a small community is trying to deal with alcohol problem in their in their area, and after that we will draw some conclusions and summarize. So look at the story of Ramesh. Ramesh is a 23-year-old man from Nilgiri. His father used to drink alcohol regularly and he was abusing his mother. He was considered a naughty boy in school and he dropped out of school after 5th standard. He worked on and off locally. 2 years ago, after his father died, he went to Coorg to work as a laborer in a farm. He was promised 50,000 rupees for 6 months' work and was paid 10,000 rupees in advance. And he was given liquor every day, and he used to drink every day. I think after a tiring day's work, he used to drink. At the end of 6 months, he was given just 10,000 rupees, and the settlement was made. And he felt very sad that he lost a lot of money, and he returned home. He was unable to sleep. He became very tremulous, restless. He felt cheated. He felt like killing the manager, and then died. If you see, in Ramesh's life, he's experienced quite a lot of harm. To his physical health, to his mental health, social well-being. Think about the lost respect when he comes back. He's not able to work now. How was his father's life when he was drinking? Marital life is not good. We didn't know about sexual life, but financial losses. And if in case he had gone and killed that guy, he would have been in serious legal trouble. So alcohol really affects individual lives a lot. But what are the origins of the problem? Let's take just one element, poverty. Now, even before Ramesh was born, his mother had malnourishment. And that increases his risk of developing neurodevelopmental disorder. He was a hyperactive kid, was not able to sit still, had learning problems. His teacher will tell him, Buddhu, you're an idiot fellow, you're not studying properly. In a way, kind of pushing him out of school. And therefore, he dropped out. Whom will he relate to? The people in his environment, which again, if a person is from poor background, he's given a kind of environment, domestic environment, school environment, neighborhood, he will actually mingle with other peers who are also dropped out, who are somewhat socially deviant, and who would all aid this starting the use of alcohol. Also, let's not forget that poverty will lead to a lot of stress, and many people who don't know how to cope well would start drinking alcohol. And once alcohol is there, slowly complications come. If you're poor, you don't eat well, you get complications at an earlier rate, and you can't access care. In all this, there is high pressure media, which makes you think that if all the ads will show beautiful people, a luxurious life, you want to identify with it, and people who are from poor backgrounds will tend to get attracted to it. And therefore, a lot of things you add to this other issues. If he's a tribal person, if you add, if he was LGBT, these things will only add to the mix of the problems that he already had, increasing the risk of alcohol related issues. Now, is it a public health problem? If we take all substances in the world, add up together all the harms that are caused by these, the number one substance which causes harm is alcohol. Interestingly, this is the only substance which causes harm to others more than the subject himself. So alcohol is a public health problem. What is the extent of the problem in India? In 2019, a large study, magnitude of substance use in India was completed, and it reports that 14.6% of Indians consume alcohol, among whom 5.2% have problems related to alcohol, and about 2.7 of them have dependence. And also we'll come back to this. Majority of the drinks consumed are spirits and country-made liquor, which have high alcohol percentage in comparison to low alcohol percentage drinks like beer. If you see, for every one woman who is drinking alcohol, there will be around 17 men who will be consuming alcohol. So it's a predominantly a male problem. But if one man is alcohol dependent, there will be 5 men who are drinking. So out of 5 people, 1 person will be dependent. So it's quite a lot of dependence in men. We also tend to think that alcohol is an urban problem, but NFHS data shows that twice the number of women in rural areas drink in comparison to urban areas. So it's not just a rural problem, it's a pan-India problem. Within India, there are differences. There are some states which have very high rates of dependence. Punjab, Tripura, Arunachal Pradesh, Chhattisgarh, Andhra, they have high alcohol dependence. But if you see the numbers of people who are having alcohol dependence, Uttar Pradesh, Andhra Pradesh, Tamil Nadu, Madhya Pradesh, Maharashtra, these will be the top. So if you want to see the harms, the health impact and economic burden due to alcohol, a study was done by a team from PGI Chandigarh AIIMS and AIIMS, New Delhi, and they did some mathematical modeling to see the for a period between 2011 to 2050, for the 40-year period, what would be the kind of liver disease, cancers, road traffic accidents which would happen secondary to alcohol. And they estimated illness, death, years of life lost, and also predicted models used to see the quality of life years gained. And what they found is about 258 million life years are lost. And if alcohol were not there, 552 million quality adjusted life years will be added. So twice the amount of gains will be there. And the cost is around $3,000 billion is lost from the health system itself. Overall burden is more than 1 lakh billion. But of course, we will be getting revenues. But even if you add the revenues, there's a net loss of 97,000 billion rupees. So it is a huge net loss to the society with alcohol. So about 1.5% of GDP. So what do we do to face this problem? Do we change, write some excellent policies, start state-of-the-art hospitals, or do we build capacity of health workers to address this issue? We'll have to do all of these to some extent. We cannot do it without adopting a community-based approach. So, which means that a lot of services should be informal through people who religious leaders, traditional healer, traditional quack, even healers, etc., who could provide some information about health, about lifestyle to people. Then you have the primary healthcare, which is the first contact for the patient with formal health services, and specialized health services only come later. As you go higher, the costs go higher. We'll see that in the example that would follow. We should also remember that we have to prevent also. So there's before prevention, there's promotion. Promotion is when you are creating environment in which you are building resilience for the problems to even not start. So, and their prevention is universal when all people are targeted, selective when populations which have higher than the normal risk are targeted, and indicated in more specified population, very focused, like boys who are dropped out from school. So that's who are showing conduct problems. So that's he's not started drinking yet, but this is a case where we would be involving for what could be called indicated prevention. Of course, getting treatment is also secondary prevention, and rehabilitation is tertiary prevention. So there's community sending, where cases are getting identified and sent. At the primary health level, people are screening and doing brief interventions and referring to treatment, giving basic treatments. Some of them are going to custodial care. Some of them are getting better and going back to the community. And promotional activities health promotion is going on in the community. So WHO recommends that health services should not be in isolation. They should be linked with community and NGO and social services. Communities where health promotion happens, cases are identified, sent, and after treatment, patients go back to those places. Their families live in the community, so you also address the needs of the family in the community. Within the health system, patients are screened, intervened, given treatments. Referrals are made within the system to address their other physical health and mental health needs. In all these, patients will have some skill deficits like communication skill problems, vocational skill deficits, social skill deficits, not knowing how to manage their money, time. Those things could be handled by NGOs and other organizations. So we should understand what is something called preventive paradox. When we see a problem, our eyes go to the most severe kind of issues. But actually, if it's much more fruitful to work on people with less severe problems who are larger in number, and even if they make smaller change, the outcomes in the community are much better. So this is a preventive paradox. So don't think about the addiction psychiatrist treating in a tertiary care center. No, his impact will be much lesser than what's happening in primary level and in the community level. So early an introduction of children into school, keeping them in school, developing literacy, numeracy, teaching children to manage their emotions, to make friends, retain friends. These skills would go a long way in preventing substance use. What should be the media campaigns? I just said 14.2% of the people drink alcohol. That means 85% of the people are not drinking alcohol. A fact that we need to keep telling. That's the norm. You should tell everyone. All children should know. Most people don't. Some people do, and they create a lot of problems. But a lot of people are not drinking. That's a message that needs to go. It's okay to not drink alcohol. And the minimum amount of alcohol that can be consumed safely is 0. So any drinking is risky drinking. Of course, there's low risk and high risk, but every drinking is risky drinking. And just in case somebody is drinking, they should not drive. So I think this message at least is quite well known. So how do we treat at different levels? In primary care also you do these things. In tertiary care you will do these at a higher intensity. You will be screening, most of you are medicine residents, you know, KH questionnaire, and also you assess, do you need to treat here, do you need to refer, you will make those decisions. Brief interventions are when you give a personalized feedback. The amount you're drinking is quite high, that kind of personalized feedback. You put the responsibility on the person, you give menu of options, you give advice to cut down, and then you support their self-efficacy, express empathy that that they are in some difficulties and when they're consuming. So you do those brief interventions, counsel. If they are not really motivated, you motivate them. There are some techniques for it. I'm not going into details. I'll tell you where to learn those things from, skills to do relapse prevention. And also you basic use of, not to forget the use of medications for detoxification and for during the maintenance phase, and sustained recovery management and vocational training. Some of it are outside the scope of a busy medical setup, but can be done and in a low-key in community setup. Education, it is even bureaucrats, judiciary, and politicians also need to learn about this. There should be modules for them in their training, and bureaucrats training and judicial officers training, that they understand issues of health and also that of addiction. Undergraduate education, I was very happy to see that competency-based curriculum has some 7 core competencies for undergraduates. I think in the future, we'll get better Indian medical graduates. Postgraduate education curriculum mentions substance use disorder, but core competencies are not mentioned. However, those skills can be, a lot of skills can be learned. If you go to NIMHANS Digital Academy, there are a lot of courses that are available where you can get certified. And also there are Nimhan's Indians one YouTube channel is there. If you go, you'll learn a lot of things for free. Even CMC runs a course called PGDMH, Postgraduate Diploma in Mental Health, where many of the skills that are required in addiction management are covered. So policy wise, if alcohol is such a problem, why not stop it? Ban alcohol. It's an easy solution, but prohibition has never worked and doesn't work. So government wants revenues and therefore alcohol will be there. So what can be done? One is policies should limit access. There should be licensing of shops. There should be limited hours. There should be age bar on the sale of alcohol. One of the most important things that works well, evidence-based intervention, is taxation. So the one who is severely addicted will pay any price. But other than them, many of us, if the price goes up, we will reduce. For example, if the coffee price goes to 50 rupees, we will definitely cut down on 1 or 2 cups per day. So the small price increase will reduce the demand. So taxation should be done. Unfortunately, inflation, the prices of alcohol has not gone up with inflation. So alcohol has become more affordable compared to the past. So it's more dangerous. So government should actually at least keep up with inflation. They should increase the prices and tax. Alcohol is covered under state, so there is no GST. So it's each state has its own complex form of taxation. So ideally, it all comes under one umbrella and proper taxation happens, it would be good. I also told you that in India, their spirits are consumed at higher amounts than beer because volume of alcohol is being taxed, not the alcohol strength. If you tax mild alcohol drink as much as stronger alcohol drink, what would I choose? Stronger alcohol drink. So we are pushing the people to use more and more spirits. So the taxation should be based on ethanol content. And only about 45% of alcohol is actually under the radar. Half of it is not even being monitored. So I think a stronger surveillance system would work. A lot of alcohol marketing is surrogate marketing. I think government should keep an eye on it and kind of curb surrogate marketing. Also, we should raise awareness in all possible means. There's an idea that a proportion of tax revenues should be used for healthcare, but that's like a double-edged sword. Why would you want to make it contingent on somebody else spoiling his health? You increase the tax budget for health, you increase taxation for people to cut down. So don't combine the two. This is another view. Before I want to discuss the case study of Association of Health Welfare in the Nilgiris, an NGO called Ashwini. It works in 2 talukas in Nilgiris district. Talukas have about a population of 2 lakhs, and they work with 22,000 tribal people. The whole group, all the people were quite disconnected till the land rights issues brought them all together. But currently they are again not as united as before. There's a lot of urbanization that has happened. Children usually drop out of school in the mid-school usually. There are poor opportunities locally, so they go as migrant laborers elsewhere. Again, they'll become alienated from their own families and they'll be experiencing loneliness. As a community, they are unjustly treated by the police. And overall, most tribal communities, people drink the locally brewed alcohol. But it being not allowed, government has pushed IMFL through TASMAC bars. There's a supply side push by TASMAC bar sending alcohol into an auto to these villages and selling alcohol. And alcohol is also used as currency in that locality. Alcohol bottles have a price. So there's a economy going on. 60% of the men are drinking. 20% of the women are drinking. Quite a big problem. About 4,000 men may be needing help to stop alcohol. So they are doing, rather than pushing them into some form of treatment, they are client-oriented. They are doing some screening and behavioral interventions in the community itself. They're increasing the motivation. Some of them are on medicines. The ones who are severe, they have tied up with a de-addiction center. About 150 patients have been treated there. So 50% are in follow-up, and about a third of them have had relapses, which is absolutely fine. And the cost, again, see, it's very cheap in community, but when you admit it, the cost is 15,000 rupees per month. So whenever you have inpatient center-based treatments, the costs go up. So they are working more through village level support groups, which also address other mental health and uh, other mental health issues. So a good job that they're doing. Similarly, most of us will be in different communities. We'll have to find unique ways of reaching out to our own people using different models with the resources that we have. Uh, so summarizing, alcohol is a problem with different risks, complications, and access to treatment in different people groups. There is stigma and discrimination. We should look into our own lives. How do we treat patients who consume alcohol? Uh, we need widespread awareness and education of multiple stakeholders. There's remember that there's great impact in working with people with less severe problems. It is not very difficult or very costly at that level. Screening, brief interventions, and referral to treatment should be the mantra. Upskilling is possible. There are enough online resources, and we should be advocating for right policies. I would end with that. I would leave some time for questions and.
Thank you, sir. Thank you for your very detailed talk, which I'm sure has enlightened many of us to the magnitude of the problem of alcohol in our communities, and also for highlighting the more holistic way to look at it, addressing policy, education, and community engagement. If there are any questions from the audience, please do send it in. I'll read out a couple of questions that we've received from our viewers online. What are the policies that can reduce the incidence of alcoholism?
Reducing availability. Policies which reduce availability and access. So you have things like you should have an age bar, limited number of hours in which a shop can be opened, taxation so that the prices go up, so that the demand comes down.
What proportion of the government income comes from alcohol sales?
I mean, it should be quite a bit. Taskmark actually beats Reliance Retail in its revenues, so it should be a significant amount. I'm not. I don't know the number.
I think there's some more, another question on explaining about the taxation a bit more with relation to alcohol sales.
I'm not a specialist in that. The thing is, alcohol is taxed differently in different states. For example, Pondicherry taxes are less. Kerala taxes are very high. So this leads to people traveling to a different state and smuggling alcohol. So the problems are, because it is listed under the state has rights to levy its own excise taxes. If it was under GST, it will be uniform. So there is a voice which says that it should be included under GST.
Thank you. Another question. Any inputs for reducing alcoholism in urban areas like Delhi and Mumbai?
I mean, in what way would urban people will be different from rural? Similar, no? What are they trying? I mean, if they were to raise the question, we could ask back and forth and understand them better.
I think they've specifically asked, is there any separate intervention for urban areas for reducing alcoholism?
I think urban areas, the better thing is that they are having more access to care, both for complications and for treatment for alcohol related things. There are health services available, both government, private. At the same, also the urban areas would also have Alcoholics Anonymous groups. So they'll have such inputs. So they are little better off than persons in the rural areas where they are all scattered, uh, far from uh, uh, far from setups where the diagnosis also gets delayed. And many times, if it is kind of accepted in the community, then the problems become even more severe before they're present.
Okay, maybe a clinical question. How to handle people with the attitude, it's fine even if my life expectancy reduces, I live with the comorbidities?
Yeah, so that's a good question, a good point. I mean, we have a tendency to kind of push people to kind of understand you are having this risk like that. So in Delhi, once I spent about half an hour in a busy OPD to explain a person with bilirubin of 10 that who was consuming 750 ml of alcohol per day, that he is having risk. So I was trying to be as gentle as possible, and I was telling, "Jaan ka bhi khatra ho sakta hai." Like, "Mar jaoge" is the worst way of saying, but I was telling that there is a risk of death. 2 weeks later, this guy came to the hospital with a pistol to kill me, to show, दिखाएंगे किसको जान का खतरा है. I was luckily in community at that day, so I missed. But so the point is, if a person is not really keen now, don't push for it. He has rights to make his choices. So we can only give feedback and take a step back, and hope that in future retain the relationship, show your concern, and he continue to respect the person and make him choice. With time, there may be some changes. So one way of increasing motivation is developing discovery. This is one very extreme case. Usually it's a person who doesn't seem to see the risks. So what you'll say, see, you want to see your daughter's wedding and all. Right now she's in 5th standard, right? You need to but you already have fatty liver, and some hepatitis has come in. So do you think drinking is in line with your long-term plan? So you've created, don't drink, you have not told. You have created this discrepancy between where he is headed and where he wants to go. So then automatically his mind will work in such a way, yeah, this is not compatible with my long-term goals, and over time he will change. So don't argue. There will be resistance, roll with it. In all this, there will be something in him which is positive, no? Express, support him in telling that he has ability to leave if he wants to, with help, and also express some empathy. So that would be the way to develop relationship to motivate him fire. It's not that you win or he wins at that point. Alcohol is our enemy and not the patient. So in the long run, he needs to leave alcohol. That should be our goal.
I may just add to what you said about communitizing this problem. I see one specific thing that I might bring out from some of the most deprived communities, the Adivasis, where particularly among the particularly vulnerable tribal groups, there's an entire marginalization of communities, the break of spirit, and of not the spirits that you talk about, but the break of spirit, and as well as such crass marginalization and labeling of people that these are all drunkards, no? And then this leads to problems that have to be handled in a particular different way. You cannot really medicalize and then say that this one person should come for for care, as well as, and you need different solutions for that. And I think in a discussion on equity, we need to really find solutions to handle this problem at a community level. So one group that we work with in Chhattisgarh, our majis, who are you would have 50% of people drunk on any particular day at any particular point of time. So therefore, the solution that you need to look at would really have to step out of the clinic and then handle it. Thanks.
Thank you so much, sir.
Thank you. There's
Dr. Philip Finney wants to say something.
Hello, Dr. Dheeraj. Thank you for the talk. The carry home message of the first statement said prohibition will not work. I'm not very sure about that statement you've made. I had an opportunity to work in Bihar for close to 10 years, and now I work in Kerala. So it's an opposite model where in Bihar, prohibition has come in. And the grassroots, when we talk to the women in the villages, they say it's actually very good. Nitish Kumar did it. Maybe he did it. He had the courage to bring in more prohibition, perhaps with vote bank politics in mind. We don't know. Kerala, we have a situation where alcoholism is only continuing to rise. So I don't know. Of course, it brings in revenue. That's one of the biggest sources of revenue for our government. So how can you just say prohibition is no? Is it in the lower socioeconomic strata prohibition works and not in the other ones? Would you any comments on this particular observation?
Even Gujarat is a dry state, but this World Cup final was going on. Everybody could get alcohol the way they wanted. Only the prices go up. So it will actually hit the back of the poor man more and there will be differentially lower disenfranchised people, marginalized people will be jailed more. So prohibition actually increases problems of a different kind. So it just pushes if you see the statistics, that magnitude of substance use in India, they have made a comment telling that the Bihar data probably is an underestimate because it's officially a dry state. So it doesn't mean that it is not there. It will not be known that it is there.
Thank you, sir. I think one last question, and this is about alcohol use among medical faculty, medical students. They know about it, but still use it. What is to be done about acceptability of alcohol in the medical community, especially as a social drink, for medical students or at conferences?
Yeah, all of us know that it is risky, and many of them do drink. And in fact, medical people, I believe, are very stressed. So they are like work hard, play hard type. 5 din work hard, Saturday pura khatam, that type. It is not good. You are actually exposing your liver to higher amount of alcohol in one given. The binge pattern, binge heavy episodic drinking actually is very, very harmful. So but this pattern is quite seen quite a lot in students and youth. So it is not good. And I think we also have I should not be preachy. I would not say, hey, don't drink. I would say that it would be good if you if you do not drink at all, and you will have little more strength in communicating an abstinence-based lifestyle to your patients. But if you drink at all, you know that it is risky, and you know the risks, and you're free to make choices. I wouldn't stop you. But I would definitely say that not drinking is better than drinking. All of us are agreed on that, no? Not drinking is better than drinking. I don't see hands. Oh.
Okay, I think we have some more time. So I'll just take a few more questions. Is there a role for promoting drinks with a lower alcohol content? And is there a role for promoting public drinking and discouraging private or drinking alone?
Yeah, so the promotion of any kind, I think we should be very careful, because if you see, I think this Vijay Mallya's interview many years ago, I heard he was for beer to be available on any kind of shop, like any beverage shop, like Pepsi or Coca-Cola. He wanted beer to be available. His idea is, if beer is there everywhere, slowly people will get the barrier to drink alcoholic drinks will come down. People start using beer. Slowly they will go into harder drinks. So it's like opening one Pandora's box. So promotion, no. But with differential taxation, the beer demand will definitely go up and spirits demand will come down. So in that manner, I think we should tax in that manner, but I don't think we should, government should promote any form of alcohol use, and should, if you see, there's one hashtag called drink responsibly. That drink responsibly hashtag is like a promotion only. All cool people showing nicely like this, and then drink responsibly. Just because you put some drink responsibly doesn't mean the image goes on. No, the big model is actually showing this. So people will actually want to, and they think, yeah, I'll drink responsibly, little bit I will drink. So there is no drinking responsibly. Okay, so that is wrong. Drinking is harmful. This is the message that should be from a healthcare perspective. Drinking is harmful. That we should be strong on that.
Thank you, sir. Can we give Dr. Dheeraj a hand for this talk? Thank you.
I would like to invite Dr. Kripat to give a memento to Dr. Dheeraj.